GE made a sonograph or sonar device that you can put in a pocket and get on a bicycle and go around a women's health clinic the whole day, you know, in Africa. You don't need that in Boston, in New York, or London, but, you know, in Nairobi, Mombasa, or Kisumu, you need it, or Douala in Cameroon, you know, to be able to increase that access to care in those places.
Well, let's try and put these pieces together, because, you know, oftentimes the reference to, you know, basic infrastructure that is required as a the prerequisite for prosperous places are the so-called network industries. You've got a network industry, and healthcare is a network industry. So if we were to put these two on top of each other, for these networks to work, what are the necessary technologies? I'll ask that to both of you.
I mean, I think to simplify it is technology and connectivity. I think that's just, you know, so key. Bluetooth technology, you know, to connect the devices. When I was the CEO of Medtronic, we had, I think, 95% of you know, the medical devices that we put in your heart, in your brain, that we could connect remotely through Bluetooth, calibrate them and check if you know, your device is still really doing what it's supposed to be doing without bringing you into the clinic or in a doctor's room to check it. So that backbone is very key. I'm going to stop here and leave it to you, Shaman.
I think for us, you know, electricity, water, and of course, telco connectivity we see is key. There's a close linkage to the GDP growth, and the boost that it gives if you've got connectivity in your market. And I think as you move into a digital economy, you need connectivity. If you don't have connectivity, how are you going to be in a digital economy? Mm-hmm. So driving that connectivity in all forms, whether it's mobile, whether it's fixed, whether it's satellite, to make sure that nobody stays unconnected. So that's our goal. When we launched in South Africa in 1994, our goal was very simple. We wanted to make it possible for every South African to own a cell phone. And in that context, we created Prepaid, not just for South Africa, but for the world. And it changed the face of telco globally. Now our new mission is, how do we make sure that everybody has access to the internet? And that's, so now we've come up with a whole lot of innovations, from cloud-based smartphones to local assemblies to, you know, basically, like Peter says, you know, devices for Africa, and then also what we call handset financing, which is, you know, pay daily and you can own a cell phone type of thing. And then if you don't pay, the phone gets locked. You pay, I call it the old call box. You know, if you pay, it opens up, and then after you've paid off the device, you know, we unlock it, and then subsidizing it from us, from the likes of the Googles and the Metas and Facebook and so on, so that you can, you know, we can drive that affordability barrier, because the more affordable the device is, the more connectivity, and then also innovative solutions. Now we're busy with rural coverage solutions, where we even building with competitors. We announced a big project in the DRC to build 2,000 rural sites with Orange, which is a competitor. Mm-hmm. But if you start with purpose, the purpose is those people need to be connected. Forget about the competition comes secondary. So then, you know, you go and you fulfill that.
And the flywheel.
And you create, you know, and then also attracting aid money. One of the things that we've learned over the years is tell your story.